All right, good morning, ladies and gentlemen. Thank you so much for joining us this gorgeous Thursday morning. It's such a pleasure to have all of you. A very warm welcome to all our honored guests, speakers, and media friends. I trust and hope you've all had your breakfast this morning because we've got quite an exciting lineup. My name is Nadia Heng, and I shall be keeping you company as your MC throughout today's event. And I have to say, it is an absolute privilege to be able to moderate this morning's proceedings. Well, I have to say as well, given the current climate with COVID-19 still at large, we truly wish we would have been able to do a physical event live and meet all of you in person. But alas, we shall look at the silver lining instead. And boy, oh boy, are we grateful for technology. So ladies and gentlemen, again, it is a privilege to have all of you dialing in from the comfort and safety of your own homes today. So, ladies and gentlemen, first of all, before we officially begin, allow me to extend a very warm welcome to our wonderful lineup of speakers and panelists whom we have here with us today. First of which is Executive Director and Group Chief Executive Officer of Health Management International Group, Ms. Chin Wei-jia. As Group CEO, Ms. Chin Wei-jia oversees and leads the strategic and operational activities of the group. And she's also the Managing Director of Mahkota Medical Center and Regency Specialist Hospital as well. So I know she can't hear you, but if you can, let's give a big cheer anyway, nevertheless, to all our guests joining us. Next up, I'd also like to extend a very warm welcome to the Chief Executive Officer of Mahkota Medical Center, Mr. Stanley Lam, who, as you recall just now, is the gentleman who said he drinks up to 5 coffees a day. Welcome, Mr. Stanley. Mr. Stanley is, in fact, his role is really to ensure that the patients have access to the highest quality of healthcare services, technologies, and treatments that will help improve their outcomes. Now, furthermore, we're also very privileged to have 2 very special guests dialing in all the way from China today. We have Professor Wang Jibiao, Chairman and founder of Chongqing HIFU Medical Technology, and the very lovely Professor Rosie Xing, Managing Director, Global Strategic Planning and International Business for Chongqing HIFU Medical Technology as well. And finally, last but certainly not least, it is my pleasure to introduce you to our main speaker of the day, who is, of course, none other than Dr. S. Selva, Consultant Obstetrician and Gynecologist of Mahkota Medical Center. Dr. Selva has been a dedicated laparoscopic surgeon, having performed about 5,000 laparoscopic surgery cases to date. And besides laparoscopy, Dr. Selva is also an IVF specialist, where he devoted himself in assisted reproductive techniques to treat his patients. So with that, let's give all our wonderful panelists and speakers a big, big round of applause and cheer them on. We're very, very grateful to have all of you join us. And with that, ladies and gentlemen, allow me to officially welcome you to the launch of the very first HIFU treatment in Malaysia for treating adenomyosis and uterine fibroids. So without further delay, ladies and gentlemen, please join me to welcome Ms. Chin Wei-jia to say a few words of welcome first. Wei-jia, over to you.
Good morning, everyone. I hope everyone's having a good start to the day today on this very special day. Dr. S. Selva, Consultant Obstetrician and Gynecologist. Professor Wang Jibiao, Chairman and Founder, Chongqing HIFU Medical Technology. Professor Rosie Xing, Managing Director, Global Strategic Planning and International Business, Chongqing HIFU Medical Technology, Mr. Stanley Lam, CEO, Mahkota Medical Center, and members of the media. Today marks a very important milestone for medical innovation at Mahkota Medical Center and for Malaysia. We are proud to launch the first HIFU, or High Intensity Focused Ultrasound medical treatment in Malaysia for gynecological medical conditions, particularly for uterine fibrosis and adenomyosis, which are 2 common conditions where benign gynecological tumors are found in the uterus. At Mahkota, we understand that many considerations made by women when it comes to treatment of their gynecological conditions. This includes major concerns such as the preservation of fertility, to other concerns such as the need for surgery, recovery time, and likelihood of permanent scarring. These considerations are also why we made the decision to invest in technologically advances that put patient care at the forefront. The HIFU treatment we are so proud to launch today is a cutting-edge technological innovation that has the potential to change the treatment landscape for women with clinically proven positive treatment outcomes. This innovative treatment will enable women who face these common gynecological conditions to opt for a new treatment method that can effectively improve their quality of life and preserve their fertility without any invasive procedure. With this, women are also no longer having to endure long surgical hours, scarring, and long recovery periods. As a woman, medical conditions, especially one that may affect one's fertility, can be frightening. Gynecological issues can often present itself during a woman's childbearing years, impacting their ability to conceive. As a result, this can not only be frustrating, but it is also alarming that many women are prevented from starting a family of their own. Motherhood is a rewarding journey, and at Mahkota, we want to preserve that joy. With the new HIFU technology offered at our hospital, we are able to do that in a manner that is non-invasive, with shorter recovery times and minimal discomfort. So I would really like to take this opportunity to encourage women who are suffering from such gynecological conditions to come forth and take advantage of the benefits afforded by our newest technological addition and benefit from the expert care of our specialists. To all mothers, best friends, husbands, and siblings of women with uterine fibrosis or adenomyosis who are striving to become mothers themselves, know now that your daughter, your best friend, your wife, and sister can be empowered with the choice of a treatment that will enable them to become mothers one day. At Mahkota, we strive to enhance the overall health of our patients and our communities we serve by continuously building and leveraging on human capabilities and technological innovation. Last but not least, I would like to thank the teams who made it possible for Mahkota to be the first in Malaysia to bring in HIFU technology, as well as our doctors and healthcare professionals who continuously put patient needs and care at the forefront. Thank you very much.
Thank you so much, Weijia, for sharing your insights on Mahkota Medical Center's dedication to providing the utmost quality to care for patients. And I'm pretty sure everyone here can safely agree that the launch of the HIFU treatment for gynecological issues is indeed a massive milestone, not just for Mahkota Medical Center, but really for Malaysia's healthcare in general. So thank you once again.
Thank you.
Now, next up, ladies and gentlemen, for the main event that everyone has been looking forward to, please join me as we welcome none other than Dr. Selva to share with us what exactly HIFU technology is and how this treatment, or how it's going to change rather the treatment, the landscape for women in Malaysia. Ladies and gentlemen, please put your hands together for Dr. Selva.
Hello, everyone. Good morning. My name is Dr. Selva, and I'm a consultant obstetrician and gynecologist at Mahkota Medical Center, Malacca. Give me a few minutes to share my slides. Okay, is it visible? Yes, okay. So today I'll be talking about HIFU. HIFU stands for High Intensity Focused Ultrasound. And we are going to talk about this HIFU treatment for two common diseases in women, and that is fibroids and adenomyosis. Now, this is the outline of my lecture. First, I'll be explaining what is fibroid. Next, I'll be explaining what is adenomyosis. Many even doctors confuse between fibroids and adenomyosis, and we'll try to explain what is the difference between these two. Then I will explain what are the treatment options currently available for fibroid and adenomyosis in Malaysia. Next, I will discuss on what is HIFU, what is the difference between the two types of HIFUs, which is MR HIFU and also ultrasound-based HIFU. How will HIFU benefit patients with fibroids and adenomyosis? Is HIFU approved by the Ministry of Health of Malaysia? Is HIFU covered by insurance in Malaysia? So these are the common questions, and I will be discussing on these questions, and at the end, we will take some question and answers. Now, first question is, what is a fibroid? Now, fibroid is the commonest tumor in women. Now, it is said that 20% of women have fibroids, and some even say that by the time a woman reaches 50, 80% will actually have fibroids. It is a benign tumor. It's not cancer. In most of the cases, it's benign. And a very small percentage of fibroids are actually cancer. So more less than 1% are cancerous or malignant. Now, the treatment is only necessary when the uterus, the fibroid is large and the uterus is large, and or the patient is having symptoms. So what are the common symptoms that women suffer when they have fibroids? Some women just feel a mass in the abdomen. They don't know that they have a fibroid until they feel something like they feel a growth in the abdomen, and with no other symptoms at all. Others may have heavy and prolonged menses. Pressure symptoms such as difficulty in passing urine, constipation, symptoms causing pressure of dilatation of the ureters are also some of the symptoms. And these you can see in this diagram. This is a fibroid, and this fibroid is pressing on the bladder. And patients with this kind of fibroids may have a feeling of always wanting to go and pass urine. This is a fibroid here, and this fibroid is pressing on the rectum. Patients with this kind of fibroids may have some difficulties in passing motion and may have constipation. And in this diagram, you can see another fibroid. This fibroid is pressing on the ureter, and this happens, urine will collect in the kidney, and the kidney may get swollen, and we call this hydronephrosis. And this is dangerous. We need to do something about this. Other symptoms are that some women may have pain, but usually patients with fibroids do not have pain. And many patients have inability to conceive or infertility when they have fibroids, and they come and see me for this problem. So now, what is this disease called adenomyosis? Now, adenomyosis is the inner lining of the uterus called the endometrium, is found in the muscular layer of the endometrium of the uterus. So this is called the inner lining of the uterus. This is called the endometrium. This is where the menses come from. If this endometrium is found inside the muscle of the uterus, now that is called adenomyosis. So it's completely different from fibroids. Fibroid is actually a growth of the muscle of this uterus, and that muscle is called myometrium. And when there is a growth, and that is called a fibroid or a leiomyoma. Whereas an adenomyosis is actually the endometrium is found inside the uterine muscle. So they both present with enlarged uterus, but they are different diseases. Now, one of the big differences is that patients with adenomyosis usually suffer from a lot of pain during their menses. They also can have heavy periods, and a lot of them have difficulty in getting pregnant or they are infertile. So one must understand the difference between these two diseases. So what are the treatment options available for fibroid? Many women with fibroids, we don't have to do anything. The fibroid is small, it is not causing any trouble, we just wait and see. So we usually ask them to come back every 6 months or 1 year, we'll do an ultrasound. And if the fibroid remains the same, it's not causing any trouble, we leave it alone. In some women with symptoms or they have difficulty in getting pregnant, we will do a surgery called myomectomy. And this surgery can be done in two different methods, a laparotomy, which is a big cut, or a laparoscopy, which is using small holes. I will discuss this in a little while. This is a fibroid. These are fibroids that are removed from the uterus, and a large majority of patients may have to undergo hysterectomy. Hysterectomy is an operation where we remove the uterus. Now, what about adenomyosis? Now, if the adenomyosis is small and it's not causing problem, we can wait and see. But if there is symptoms, then we need to do a surgery to remove the adenomyosis, and that surgery is called adenomyomectomy. Now, adenomyomectomy is not an easy surgery to perform as opposed to myomectomy, because it's difficult to know the limits of the adenomyosis as opposed to the fibroid. A fibroid we can cut and the fibroid can be taken out, whereas adenomyosis is difficult to cut because it is found all over the uterus. And many patients may actually end up as for hysterectomy. That means we remove the uterus. So this is the sad part of patients with adenomyosis. Now, this is an adenomyosis, and this is a fibroid. This is the difference between the two. Now, this is what we call as an open surgery. We make a big cut and do a surgery, and this is called laparoscopic surgery, where we make a few small holes, and then we do the surgery to remove the fibroid. And here, the two different methods are different. In the olden days, most of the surgeries are done with this kind of surgery where you have a big cut like this to do the surgery. But now we do these surgeries with only small incision. This is my specialty, doing surgery by laparoscopy. But how if we can do a surgery without any scars at all on the abdomen? Now, this is what we call as HIFU, or high intensity focused ultrasound. Now, high intensity focused ultrasound, we use ultrasound beams and focus it into the fibroid and adenomyosis and destroy the tissue, causing them to shrink. So this is the concept behind high intensity focused ultrasound, or HIFU. Now, we all know that if we have a magnifying glass, we can take a ray of the sun and then focus the beam onto a leaf, and then we can cause the leaf to burn. In a similar manner, we can use this transducer and we can focus a beam of ultrasound into a tiny area, the size of a grain of a rice, and then cause that area of the disease to die. And that is what we call as ablation. So what happens is that that focal area will undergo death or necrosis, and that cells will then die. And that is what we call as HIFU. So HIFU is not radiation. It is using ultrasound to do the job. So I think you need to understand that many people confuse ultrasound with laser or with radiation. Laser is using light, and radiation is using radioactive material, whereas ultrasound, we are using ultrasound to do the job. So here I'm showing you an animation. Now this is an ultrasound transducer, and this transducer focuses a beam of ultrasound onto a small spot. And once one spot has been ablated, we move on to another spot, and then another spot, and then another spot. And then the whole fibroid or adenomyosis can then be killed or destroyed. This is another diagram showing this is liver. There's a lesion in the liver. So what we do is we take the lesion and we cut the lesion using an ultrasound into several layers. And then we will burn or coagulate that one layer one at a time. And you can see here, each layer is cut one at a time. And then when the fibroid is there, it will then be ablated. I'll show you one more animation. In this animation, you can see this is the transducer, and the ultrasound beam is injected into this fibroid. And then what happens is that it becomes white. We call it a grayscale change. And then we move to one more spot, and then we go to one more spot. And with that, we get the disease ablated. And then now the whole fibroid will then be ablated. Now, this is a very nice diagram, video showing the safety of HIFU. Now, this bowl is the one that shoots the ultrasound beam. And you can see that ultrasound beam is being shot onto the plate. I'll play this again. And because the ultrasound beam is shooting onto the plate, you can see that there is a focal point here. And when you put a hand inside, there is no injury to the hand. So what is showing is that there is safety along the path. Only the point in which we are coagulating will get destroyed. So that is the safety of ultrasound. This is another video showing how we do this HIFU. This is a laboratory. We are using an ox liver, and this word Chongguo is written on the computer, and this is being burnt into this ox liver. So what we are doing is we are using the ultrasound beam here, and we are using this probe to write this word in the center of this ox liver. So you'll see that this word is being burned. And then what we can see is that outside there's nothing. And when we slice this ox liver, you can see that the word is precisely written in the center. So this shows how precise this technology is to do this kind of writing right in the center of a liver. Now I'll show you this video to give you an idea of how HIFU works.
An ultrasound beam can be brought to a tight focus at a distance from its source, with sufficient energy concentrated within the focus. The cells lying within will be killed without damaging the surrounding tissues. High-intensity focus ultrasound, HIFU, is, therefore, a non-invasive method of producing selective and trackless destruction of deeply seated tissue targets within the body, without causing any damage to the overlying surrounding tissue.
So this shows how a HIFU is done, and the next video will show a patient who is coming in for HIFU. So this is a patient. She's coming in to undergo HIFU. She walks into the operating theater, and then she lies down on the HIFU table. So now we are preparing the patient. So what we'll do is we will give her some injections, and this is the injection, and the injection will just be a sedation. And here we are looking at the MRI image of this patient. This patient has got a large uterine fibroid. And once that is done, the doctor will then use the machine to shoot this ultrasound beam into the uterus. And while it's being done, the patient can actually talk to the doctor. She is under sedation, but we call it a conscious sedation. The whole procedure will take 1 to 2 hours. There's no surgery, no scar, no bleeding. And after the procedure, the patient can just walk back to the ward. And this is how the procedure of how HIFU is performed. So now, what are the advantages of HIFU? There are many advantages of HIFU therapy. Now, this is a therapy to preserve the organs. Now, what I mean by preserve the organs is we want women with uterine fibroids and uterine adenomyosis not to have a hysterectomy to remove the uterus. This technology, we aim to keep the organs, to keep the uterus. There's no blood transfusion, there's no radiation. It can be done as a day surgery. That means the patient can come in, we do, and then after evening, she can go back. But most of the time, we keep them one night just for insurance purposes. There's quick resumption of work. Many of the women, within 3 or 4 days, they can actually go back to work. There's no short usage of beds in the hospital. It is comfortable. The patient may feel a little bit of discomfort while the surgery is being performed, but after the surgery, they will have not much pain. It does not require general anesthesia. It's done only under sedation. The patient is comfortable and relaxed, and also there are very few complications. Now, I will show you the benefits of HIFU for fibroids and adenomyosis. Now, firstly, for fibroids, there is no scar, and the patient does not have any scar in the abdomen. There is minimal post-operative pain. The patient can return to work faster. As I told earlier, it's a daycare surgery. That means we can actually do it within a day. They can come in the morning and go back in the evening. It is done only under sedation. No general anesthesia is necessary. So even in patients who have serious medical conditions who are not suitable to do surgery, we can do HIFU for them. It can be repeated. Many fibroids, we do surgery and remove the fibroids, and after a few years, the fibroid comes back, and then we can do a second surgery. Here, if that happens, we can do the HIFU again, so that the patient does not have to undergo multiple surgeries. One of the most important things is there's no scar in the uterus, and this is very important because when we do surgery, we cut the uterus and we take out the fibroid, and then we stitch back the uterus. In HIFU, there's no cut in the uterus. We just do ablation of the fibroid, and then we shrink the fibroid. And because the patient does not have any scar on the uterus, she can have a normal delivery when she gets pregnant. As opposed to surgery, we have a cut in the uterus and the patient have to undergo cesarean section. So it's one of the big advantages. And another bigger advantage is to avoid hysterectomy. As I said earlier, many women with fibroid, the doctors will tell them it's better to remove the uterus. And by doing HIFU, we can avoid a hysterectomy for the patient. The next is adenomyosis. Now, adenomyosis have the same benefits: no scar, minimum post-operative pain, return to work faster, day surgery, done under sedation, no scar on the uterus. But the biggest advantage is to avoid hysterectomy. Many of my patients with adenomyosis previously, because the disease is so bad and the patient have got so much pain, even if the patient does not have any children, the patient may have to undergo hysterectomy. Now with HIFU, we can ablate the adenomyosis and then help the patient to get pregnant. So this is one of the biggest advantages of HIFU, especially for patients with adenomyosis. So here you can see some examples. This is a patient with fibroid. We call this a posterior fibroid, or fibroid at the back part of the uterus. We have done the HIFU. The HIFU has been ablated, and then slowly, as time goes by, the fibroid will then shrink. This is another patient with many fibroids, multiple fibroids, and we have done and HIFU has been performed, and then the uterus will then slowly shrink. Now, patients with adenomyosis, this is a patient with adenomyosis. This is an MRI finding, and you can see that this is adenomyosis. And after MRI, this is how it looks. And then slowly this uterus will then shrink. This is the one is called focal adenomyosis. It's called globular adenomyosis. Some women are very unlucky. The whole uterus is filled with adenomyosis. And this is what we call as a globular adenomyosis. And these are patients where ultimately we have to have a hysterectomy. And we can do HIFU on this patient. And you can see HIFU is done. The fibroid, the adenomyosis will then shrink, and then the patient can save her uterus. So I'm going to spend a little bit of time on the two different types of HIFU. You may have heard of something called MRI-based HIFU. And this is actually developed by two companies called Philips and GE. And this is how it looks. It's a big tunnel. And this patient had to go into the tunnel to do the HIFU. And this is what we are introducing today is the Chongqing HIFU company's HIFU, which is an ultrasound-based HIFU. Now, there's a difference between these two. HIFU technology is actually not new. It is actually developed in the 1950s. Only in the 1980s and 1990s, the technology was used for treatment of diseases. The first treatment that came out is actually what we call as MRI-based HIFU, in which the HIFU is done in an MRI machine. And this is available in Malaysia in 2 universities but for the last 10 years. But unfortunately, it didn't do very well. The reason is because of many disadvantages, as I will discuss in a little while. Ultrasound-based HIFU has been available for about last 10 years, and this is developed by this company called HIFU from Chongqing, China. So this is the two different types of HIFU. MR-based HIFU, that is here, this is how it's done, and ultrasound-based HIFU is by this diagram. Now, there are many advantages of ultrasound-based HIFU. The big advantage is that it is shorter duration of to do the procedure is much shorter. It takes only 1 to 2 hours and the average to do this surgery, whereas in an MRI-based HIFU, it takes 3 to 4 hours. Now, why is that so? Why does it take longer? The reason is because MRI-based HIFU is done in a tunnel. There's no space to work, so the transducer movement is not very good. Patient positioning is difficult. It is not done in real time, whereas ultrasound-based HIFU is done in real time. All this makes treatment time longer with MRI-based HIFU than ultrasound-based HIFU. Another big advantage of ultrasound-based HIFU is that because ultrasound is more easy to apply, you can get a better success rate with ultrasound-based HIFU. We use something called non-perfusion volume ratio. That is the amount of fibroid that is destroyed by the HIFU. And with ultrasound, we can get up to 80 to 90% destruction of the tissue, as opposed to only 20 to 50%. Another big advantage is cost. Ultrasound-based HIFU is cheaper than MRI-based HIFU. And also ultrasound-based HIFU can be done by a gynecologist like myself, whereas ultrasound-based HIFU can only be done by a radiologist. So because of this, although MRI-based HIFU has been available in Malaysia for the last 10 years, it never really did very well. And that's the reason why we are now introducing for the first time in Malaysia this ultrasound-based HIFU. Now, how well accepted is ultrasound-based HIFU throughout the world? Ultrasound-based HIFU is available now in 29 countries in the world and 250 centers just in Asia. It is, of course, available in China. It's available in Taiwan, Hong Kong, Japan, Korea. It's available in Thailand. It's been available in Singapore for the last 2.5 years. It's available in many countries in Europe, such as the United Kingdom, Germany, Spain, Italy, and it's also available in Africa, in South Africa, and now recently in Nigeria. It's also available in South America. There are almost 10 centers in Europe that is doing HIFU, and more than 180,000 patients have been treated with HIFU. So it is not a new treatment. It has been there for almost 10 years, and there has been a lot of patients who have been treated, and there are a lot of published literature to show how effective HIFU is for fibroid and adenomyosis. So these are the clinical indications for HIFU. Let me go back to this slide. Okay, these are the clinical indications for HIFU. Now, HIFU can be used for uterine fibroids and adenomyosis. This is what I'm discussing today, but it can be also used for breast lumps, benign breast lumps, and it can be used for a lot of cancers, such as liver cancer, kidney, breast, pancreas, bone, soft tissue, and metastasis. We are not starting this treatment yet. We will start with uterine fibroid and adenomyosis. And later, when this has been established, then we will go on to using HIFU to treat cancers as well. Now, next, second last question I would like to answer is treatment approved in Malaysia? Now, in order for this machine to come into Malaysia, we need approval from the Ministry of Health, and the department that's involved is called the MDA, the Device Authority, the Medical Device Authority, and that approval, we got it almost 4 or 5 years ago. And this machine has already been installed in the Mahkota Medical Center in January, and we have got the license from the Ministry of Health to do this approved. So it has been already approved by the Ministry of Health. Some people believe that it's not approved. If it's not approved, we will never be able to do it in Malaysia. The next question is it covered by medical insurance in Malaysia? Yes. Most of the major insurance companies have approved this, and I've already done almost 17 cases since we launched this, since we started treatment. This is our HIFU center. This is how it looks. This is a 3D view of the HIFU center, and this is the console where we sit to do the treatment. This is the table. The patient lies on the table when the procedure is done. This is the ultrasound machine where we control the images, and this is the center. This is our HIFU center at Mahkota Medical Center. We started the HIFU service exactly 1 month ago on the 12th of July, and so far we have done 17 cases, and out of the 17 cases, 14 cases were covered by insurance. I will give you an example of a patient which we did last week. This is a 47-year-old lady. She's single. She's actually has a large uterine fibroid. This fibroid is so large that it goes above her belly button, an umbilicus. I think this fibroid would be at least 2 kilograms in weight. Its size was 13 centimeters by 12 centimeters by 8 centimeters. This is the MRI of the fibroid. And this is what we call as a contrast MRI of the fibroid to see the blood flow in the fibroid. And this was done 1 day after the treatment. We treated her last Tuesday and Wednesday. When I do the MRI, almost 90% of the fibroid has already been killed. And this fibroid, we wait for the fibroid to shrink. Most of the doctors who saw her told her to remove the uterus, and she didn't want to remove the uterus. So when she heard about our treatment, HIFU, she came to see us, and we did the treatment. And now she was discharged. She was done on Tuesday. She was discharged on Wednesday. And this Monday, she went back to work. She's actually an insurance agent, and she has a chance to go back to work very quickly. So this is the big advantage of HIFU for fibroid and adenomyosis. So in conclusion, HIFU is a good technology to help women shrink their fibroids and adenomyosis without undergoing surgery. Women can keep their uterus and not undergo hysterectomy after undergoing HIFU. This is a very big advantage for women, especially for women who want to conceive, who want to get pregnant. We can save the uterus for them. So most major insurance companies are covering for HIFU treatment because they understand the benefit of HIFU for women and also to the society. Women are now working and they can get back to work very fast. Thank you. Back to you, Nadia.
Thank you so much, Dr. Selva, for that very, very enlightening presentation. And of course, for sharing with us the benefits of HIFU treatment for gynecological issues such as adenomyosis and uterine fibroids. So, I think safe to say HIFU is going to be a massive game changer for women across Malaysia. And let's use this, ladies, as a gentle reminder for all of us to make sure we go and get checked from time to time as well, and to seek out the best treatments for us. Well, ladies and gentlemen, the time has come, I'm sure, the moment that many of you have been waiting for, especially after that very, very fascinating presentation by Dr. Selva. So it's time now to open up for some questions. But before we do that, I'd like to invite and introduce once again our wonderful panelists who will be joining us for the Q&A. Of course, we'll be having Dr. Selva, Ms. Chin Wei Jia, and in addition to this, we also have our special guests joining us, including Mr. Stanley Lum, Professor Wang, and Professor Rosie, who will all be on standby to assist if needed. So with that, ladies and gentlemen, if you have any questions, I notice we already have a couple of them popping into the Q&A box. So if you have yet to do so, please feel free to drop them into the Q&A box, and I'll be reading them out one by one to our panelists. All right, so ladies and gentlemen, I think we're ready to dive right in. So let's start off with the first question. This is for you, Dr. Selva. And by the way, to our media friends, if possible, please remember to also put in your publication or the title that you represent. That would be also very useful for us as well. All right, so our first question is for Dr. Selva. This is from Shikin. So Dr. Selva, once the fibroid is removed by HIFU treatment, how does it actually come out from our system? How does it come out from our body?
Okay, thank you for the question. I think it's a very good question. Maybe I didn't explain it during my talk. Now, when we do surgery, we cut and we take out the fibroid from the abdomen and then we stitch it up. Whereas here, it's different. We are causing the fibroid to die inside the uterus. So we are using high energy to kill the cells of the fibroid by two methods, basically by heat and by vibration or acoustic damage. And once the cells are damaged, their blood supply will then come in and remove the cells that are dead through the bloodstream. And that will be then damaged and removed from the body, as you said, through urine, through liver, through breathing. So that's how it works. So anything that is dead in the body has got a mechanism of taking it away. And that's how the fibroid shrinks. I hope I answer your question. So usually when we do this kind of surgery, when we do HIFU, Professor Wang actually advised patients to be very active so that there will be very good blood flow in the uterus, in the abdomen. And when they are active, the tissues will then be removed from the body much faster than in people who have a sedentary life.
Okay, thank you very much, Dr. Selva. I think that's a very, very good explanation. Thank you, Shikin, for your question. Our next question is, if I could request, of course, to our media friends, please remember to put your name in and your title as well before popping in your question. So we'll be moving on to this next question from Jitsin. Can I have a ballpark figure of how much the procedure would cost? This is Jitsin from MIMS Doctor here.
Yeah, am I allowed to say figures in this media? I think I can, isn't it? Okay, what we want is this procedure to be not too expensive. So, and also we want it to be about the same price as what I do for laparoscopic myomectomy. So my cost for doing a laparoscopic myomectomy is about 25,000. So this 25 to maybe 30,000. So this particular procedure, we are doing it for about 25,000 ringgit. Now, if I'm allowed to say, this procedure is available in Singapore and in Hong Kong, and will cost you 3 times as much to do this procedure in that 2 countries compared to in Malaysia.
Thank you very much, Dr. Selva. Okay, we've got another question from Jitsin, who would like to know how many patients so far have undergone this procedure so far. I'm not sure whether it's in reference to Malaysia or... Yes,
I'm sure she is asking about Malaysia. Yes, we have been only open for 30 days. That is, we started on the 12th of July last month, and today is 12th of August, and we have already done 17 cases. Tomorrow we will be doing our 18th case. So even without publicity, without launching, we already have 17 cases. I'm sure we will be doing much more. The advantage of working with Chongqing HIFU is that I have with me a doctor from China, from Chongqing, who has done almost 2,000 cases, sitting with me, doing the procedure with me. This is new technology. I've gone for training, but I am also very new. Although I'm very good at laparoscopic surgery, as the MC said, I've done 8,000 cases of laparoscopic surgery. But as opposed to HIFU, this is new to me. So I need to be trained. And that's the reason why Dr. Huang, who has come from Chongqing, China, is sitting with me to do the cases, every case that I do. And she will only leave when I am really competent to do it by myself.
Fantastic. Thank you, Dr. Selva. All right, we've got another question from Jitsin as well. So it's in regards to the cases of large fibroids, where there is a large amount of dead tissue. Is there a worry of the body going into shock after the procedure?
This has never happened. There are a few people who ask about the same situation. Is there a possibility of infection? Is there a possibility of shock? No. The way in which it is done is that we cause acoustic necrosis It is not like dead tissue. It just gets absorbed. So there's no worry. In fact, the lady whom we did, as I showed you earlier, she had probably 2 kilograms of fibroids in the uterus, and we might have ablated 1.8 kilograms, and she's very well. There's no fever, nothing at all. And this has been done over the years. It's about 180,000 cases, as I told you, has been performed on different sizes of fibroids, huge fibroids, multiple fibroids, and there's never been a case of a patient having shock or infection in the uterus.
Okay. All right, our next question is from Kairunisa Sukri, and it's, can HIFU be done for kidney stones like in extracorporeal shockwave lithotripsy?
Yeah. The concept is the same. The concept is the same. Lithotripsy has been there for a long, long time, 20, 30 years. And in that one, what is done is that sound waves is used to shock the stone and then break it up and then come out. The principle is the same, but the technology is different in HIFU. HIFU, what we are doing is we are actually coagulating and killing of cells. So it's much more difficult to develop this technology as opposed to lithotripsy, but the concept is exactly the same.
All right. Thank you, Dr. Selva. Okay, our next question is from Sheelin, from the Asian Woman. And she asks you, Dr. Selva, you mentioned the price of HIFU being 3 times higher in Singapore and Hong Kong. So what is the reason for that?
There's only one reason for it. The doctor's charges in Malaysia is very low. The cost of the machine, whether it is bought by Singapore, Malaysia, Hong Kong, wherever it is, the cost of the machine is the same. But in the other countries like Hong Kong and Singapore, doctors' fees is very, very high. And because it's very high, the cost becomes very high. In Malaysia, we are controlled by the Private Healthcare Act. And our fees is actually very low. You won't believe it. I can sit and do the surgery for 4 hours, and my fees is only 2,040 for performing that surgery. And it's the same. If I do it by laparoscopy, that is the same fees I get. So that is the reason why it is cheaper in Malaysia compared to the other 2 countries.
All right, thank you, Dr. Selva. We've got one more question here from Kairunisa Sukri, and she would like to ask, is there any chance of adhesions and how can it compare with conventional surgery?
Okay, again, this is a very good question. Now, when we do surgery, for example, we do open surgery, there is a high chance of adhesions. When we do laparoscopic surgery, the chances of adhesions is actually diminished because we don't put our hands into the abdomen to perform the surgery. That's the reason why I do laparoscopic surgery, because most of my patients are what we call as infertile patients. They have got difficulty in getting pregnant. If you do laparoscopic surgery, your adhesions will be lesser. But in HIFU, there will not be any adhesions at all because we are not putting our hands into the abdomen at all. We are just ablating the fibroid within the fibroid. There's no worry about adhesions at all. That's a big advantage of HIFU compared to laparoscopic surgery and open surgery. And thank you for this good question.
Thank you. Thank you, Kairunisa. All right, our next question is from Esther Choi from Good Health. Oops. Yeah, may I know who would not be suitable for this treatment? Okay, another very good question. Because of the short time frame, I didn't talk about a lot of things. Now, not everybody we can do HIFU. Now, one of the big disadvantages of HIFU is to do it on very big size people, obese people. The depth in which we can get for the HIFU is only 12 centimeters. If the patient is very big and the fibroid is very far behind, we cannot reach the fibroid with HIFU. So everybody who we see, we will actually place them on the machine to do something called simulation. We'll simulate to see whether we can get to the fibroid and adenomyosis, and then only we do. So I won't say that everybody we can do HIFU for all the patients. Another situations, for example, patients with something we call subserous fibroids. Subserous fibroids are fibroids that are sitting on the uterus or are pedunculated. They are attached to the fibroid by a short stalk
we don't suggest to do HIFU. So we will actually look at the situation. Another important factor is the patient must be able to lie on the table for about 2 to 3 hours. Some people just cannot lie down for that long. Then we can't do the HIFU. And also patients who have many scars on the abdomen. What happens is that the HIFU may absorb the energy and cause burn in the scar tissue. So these are conditions in which we cannot do HIFU. So HIFU is not for everybody, but in a majority of women, we can perform HIFU for fibroids and adenomyosis.
Thank you. Thank you so much, Dr. Selva. So ladies and gentlemen, please remember, we still have a little bit of time. So if you have any questions, you can always pop them into the Q&A box. But in the meantime, I have a couple of questions of my own, Dr. Selva. Maybe you could help me with these. So first of all, why is HIFU used for uterine fibroids and adenomyosis only at the moment?
Okay, the reason is because to get the skills to do this, this is not easy. I am sitting every day with my teacher to learn these skills. So later we will send doctors who are skilled to go and learn how to do use fibroids for other diseases like liver tumors, pancreatic tumors. These are much more difficult to learn. So that's the reason why I'm starting off with fibroid and adenomyosis. And once that is done, either myself or someone else, we will send to China to get the training and also to do these other much more difficult conditions to treat with HIFU.
Okay. Well, Dr. Selva, are there any side effects from the treatment?
Good questions. I didn't mention because I didn't have the time just now. Yes, anything we do in life has got complications. I always tell my patients, you drive from your house to the hospital. Is there a complication? Yes, there is. You may get, you may be involved in an accident and something may happen. You fly on a plane. Is there a complication? There is. So when we do surgery, there is complications as well. Complications will include bleeding. We may have injured the bladder, the bowel, the ureter. I tell all this to my patient. It happens. Similarly, HIFU has complications as well, but the complication rate, especially major complication rate, is very, very small. It is actually 2 in about 100,000. The biggest complication that we worry about is bowel injury. What I mean by bowel injury is the ultrasound beam actually somehow burns the bowel and makes a hole in the bowel. This is the one that we are most worried about. So that's the reason why we take all the precautions. But this complication is far lesser than the complication that occurs during surgery. For example, laparoscopic surgery or open surgery. Other complications that are very much more common are skin burns, because sometimes this energy can get absorbed by the skin, especially women with scars. Scars are very, very easy to absorb. So we take all the precautions. We do methods, we do things slowly. We reduce the energy in patients with scars. They may have some burns on the scars, very superficial burns. And other complications are sometimes patient may have vaginal discharge, some fever, a little bit of pain, but these are very mild complications. So the most worrying complication, as I told, is bowel injury, but it is far lesser than what can happen during surgery, which is laparoscopic surgery and open surgery.
So can it actually affect any of the patient's other organs?
It is impossible, because when we do the surgery, we take all the precautions. The other worry is that some of the energy may actually, what we call a splinter and affect the nerves in the back, especially what we call as a sacral nerve, the nerve that travels down the spine and the leg. So that's the reason why we do this surgery under conscious sedation. That means I will constantly ask the patient, do you feel any pain in the back? Do you feel any pain that goes down the leg? If it happens, we stop. That's the reason. So its incidence is very, very, very low. This is all prevented by all these precautions that we do.
Okay, thank you so much, Dr. Selva. All right, just a reminder to our media friends, if we have any final questions, we have a little bit more time. So if you have any final question, please do pop it into the Q&A box. All right, so last but not least, I'd love to ask you, Dr. Selva, maybe you can elaborate a little bit more about the effectiveness of HIFU treatment.
Yes, the biggest advantage, I am a fertility specialist. I've been a fertility specialist for almost 25 years, and I'm a laparoscopic surgeon. I'm a laparoscopic surgeon for 28 years. The biggest advantage, I think, HIFU will be the group of patients who want to get pregnant. Because women who want to get pregnant, their uterus need to be preserved, and we need to try to improve the situation of the uterus so that when we do IVF, for example, the uterus will be able to implant the embryo. So HIFU will be an excellent choice for this, especially for patients with adenomyosis, where we don't have any good treatment option now. So when we do HIFU, we are doing non-invasive ablation of the adenomyosis. We shrink the uterus, and then when we do IVF, the patient can get pregnant. In fact, what my aim is, I've already done quite a number of patients with these conditions. We ablate, shrink the uterus, and hope the patient can get pregnant on her own, even without IVF. I think this will be the biggest benefit of HIFU to women in Malaysia.
Wonderful. That sounds amazing. Well, it looks like we have a question actually that's just popped into our Q&A box. Thank you, Esther, for your question. This is Esther from Good Health Magazine. And Esther would like to know how long the procedure actually takes. And also today, so if let's say, for example, they meet you today, Dr. Selva, is it possible that tomorrow they can already go for treatment, or do you actually need to go for a full body check again? Good question.
No, it is not as simple as that. Now, first, I need to see the patient, and I need to first examine her, take a history. I need to do an ultrasound. Then what we will do is we will do an MRI. After the MRI, we will take the patient to the machine, and we will do something called simulation. So we will simulate to make sure that the adenomyosis or fibroid can be done. And once that is done, then we have to apply to the insurance company for approval. And the patient has to have a bowel preparation for 4 days. Usually for 2 days, they will be on a low fiber diet and 2 days on liquid diet. And then only we can do the surgery. So we have people, I have patients who have already come from Sabah to do these procedures. They want to just come and straight away do. I have patients from Ipoh, from Kuala Lumpur. They don't want to come only in one instance. So what we usually tell them is, please do your MRI in your place and send the MRI to me. We will look at the MRI, and I will discuss with my teacher, Dr. Huang, and we will look at it. I think this is a suitable candidate for HIFU. Then over the phone, we tell them to prepare their bowel for 4 days, and when they come today, we simulate them, and if they are suitable, we can do it tomorrow. We have done that. So it is all communicating with us, and then get the correct information so that you don't, with this pandemic, people don't want to travel too many times. I've got many calls from patients from Kuala Lumpur and other parts of the country. And that's what we tell them. If you plan properly, you can do that. You can actually come today and do the treatment tomorrow and go back the day after tomorrow, 2 nights in Malacca. That's it.
Thank you for that. At the moment, we've got another question that's just come in. Thank you, Karenisa. Can HIFU be done for malignant tumors, and is there any risk of metastasis of the malignant tissues?
Okay, if you look at fibroid and adenomyosis is almost rare to become a cancer. Fibroid can be cancerous. As I said, there may be 1% that can be what we call as leiomyosarcoma, that is cancer of the fibroid. We do an MRI to see whether there's any features of cancer. If there is, then we will not advise them to do HIFU. If there are no features, then we will do HIFU. Now, there may be some patients who actually has cancer and we have done the HIFU treatment. And actually, when I first was introduced to HIFU, I asked this question to my professor, Professor Lian Zhang, what happens in this situation? He as well answered that if that happened, so be it. We have killed the cancer and the cancer will get absorbed, and there's nothing will happen. So if the fibroid after doing the HIFU does not shrink, then we are worried that it may be cancer. Then the patient might have to remove the uterus. As opposed to other malignant diseases, which we have talked earlier, for example, liver cancer, pancreatic cancer, yes, people are using HIFU to treat these cancers, especially in those patients who failed surgery, who failed radiotherapy, who failed chemotherapy. Then we have another option to use HIFU to shrink these diseases. So this is the area that we will be going into in the future.
Thank you so much, Dr. Salva. All right, it looks like we don't have any questions from our media anymore, but before we wrap things up, I would like to ask, of course, our Executive Director and Group CEO of Health Management International Group, Ms. Chinwei Jia, what was the reason for investing in this technology for Mahkota Medical Center?
Yeah, I think when Dr. Salva shared with us about this technology, and we're also familiar about this technology being used in other countries, such as Singapore, we were actually very excited about the treatment options and the possibilities of empowering women and giving them a choice on treatment that will help them preserve their fertility. And I think at the end of the day, what we really want to do is enable our patients to utilize, the latest in technology, plus of course, the specialized skill sets of doctors to get better outcomes or prevent, certain side effects or consequences from happening as a result of the treatment. That's why, we are really, really honored and proud today to be launching, the first HIFU treatment in Malaysia, and we really hope that this will help positively impact and change the lives of many women.
Thank you so much, Wei Jia, and I'm sure that it's going to do exactly that. Thank you very much, Dr. Salva. Thank you, Wei Jia. Thank you, Mr. Stanley, Professor Wang, and Professor Rosie. It has been a very, very insightful discussion indeed. So, ladies and gentlemen, before we wrap up today's event, though, it's my privilege to now invite Professor Wang to give a few words of congratulatory celebrations to Mahkota Medical Center for launching the very first HIFU treatment in Malaysia. So, ladies and gentlemen, let's welcome Professor Wang.
亲爱的Dr. Salva， 亲爱的秦维佳女士，还有亲爱的Stanley 郎，祝贺你们。
Dear Dr. Silva, dear Ms. Chinwei-Jia, and dear Ms. Stanley Long, my sincere congratulations to the grand opening of the HIFU Center for the Mahkota Medical Center.
今天是你们也是整个聚焦超声这个领域的外科的领域的喜庆的日子，祝贺你们加入到这个伟大的事业里面。
And today is not only a joyful day for you, but also for the HIFU family and for the field of focused ultrasound ablation. Welcome to join the global endeavor of bringing this non-invasive treatment to more and more patients.
我很高兴这台先进的设备进入到我们仁爱医院，希望这项技术能够更好的服务于广大的患者。我相信成千上万的女性会为此而保住子宫，当然也会有更多可爱的宝宝能够来到这个世界。
My great appreciation and gratitude to the leadership of Mahkota Medical Center for your vision and support. And I hope this technology will serve the medical needs of women, Malaysian patients, especially those women who suffer from infertility but wish to preserve the uterus and fertility. And I believe we'll have the opportunity to welcome more babies to the world owing to this technology.
我更相信 Dr. Salva 的智慧和爱心，以及仁爱医院的支持，会让马来西亚的 HIFU 中心做出品牌，并影响全球。
I have no doubt that with the wisdom and the compassion for patients of Dr. Silva at the Mahkota Medical Center, and with the support of the leadership from the medical center, this HIFU Center will be the center of excellence and it will make a great global impact on the development of the minimally invasive and non-invasive medicine.
非常高兴参加今天的开业仪式，并祝愿大家幸福安康。我现在向 Dr. Salva 学习，每天早上起来跑步。
And it is my great pleasure to participate in this event and stay healthy till release. And a professional says he is doing the same thing as Dr. Silva do. keep running every day and keep healthy, stay healthy.
Yeah.
And thank you.
Thank you. Thank you.
谢谢 Professor Wang， 今天能够抽空出席今天的活动。Thank you so much once again, Professor Wang, ladies and gentlemen, for that wonderful speech indeed, you know, wishing Mahkota Medical Center well. And of course, so once again, thank you very much to all our speakers, our panelists, and of course to all our honored guests and our media friends for joining us today in the official launch of HIFU technology here in Malaysia. So with that, ladies and gentlemen, I hope that with all the information that's been shared today, it will provide all of you with a better understanding around the benefits of HIFU technology and why it is going to be such an incredible game changer for women who are suffering from adenomyosis and uterine fibroids. So if you do have any further questions, which we didn't manage to address today, please feel free to reach out to the Edelman Malaysia team via email. They'll be delighted to assist you with any inquiries that you have. So with that, my name is Nadia Heng, signing off, wishing all of you the very best of health. Take care until the next time.